Understanding retinal detachment, types, causes, and treatment options. Retinal detachment is a serious eye condition that requires immediate medical attention. The retina is a vital component of the eye responsible for converting light into signals that the brain interprets as vision. When the retina detaches from its normal position, it can cause vision loss or blindness if not treated promptly and appropriately. This article explores the different types and causes of retinal detachment and discusses available treatment options. Types of retinal detachment. Rhegmatogenous retinal detachment, RRD. Rhegmatogenous retinal detachment is the most common type and occurs due to a tear or hole in the retina. This tear allows the vitreous, a jelly-like substance that fills the eye, to seep through and accumulate behind the retina, detaching it from the back of the eye. As the vitreous pulls away, it can create traction on the retina, leading to the formation of a tear. Tractional retinal detachment, TRD. Tractional retinal detachment occurs when scar tissue or other abnormal growths on the retina create traction, pulling the retina away from the eye wall. This can be a result of conditions like diabetic retinopathy, where abnormal blood vessel growth leads to scar tissue formation, exerting force on the retina. Exudative retinal detachment, ERD. Exudative retinal detachment happens due to the accumulation of fluid in the subretinal space between the retina and the back of the eye. Unlike rhegmatogenous detachment, there are no tears or breaks in the retina. Conditions like age-related macular degeneration, inflammatory disorders, or vascular abnormalities can cause exudative retinal detachment. Causes of retinal detachment. Aging is a significant risk factor for retinal detachment. As individuals age, the vitreous gel in the eye tends to shrink and become more liquid. This change can lead to the vitreous pulling away from the retina, causing tears or holes and eventually retinal detachment. Trauma. Physical trauma to the eye can cause a tear or detachment of the retina. Blunt force trauma or injuries that cause sudden shifts in the eye's structure can lead to retinal detachment, especially if there's a direct impact on the eye. Myopia, nearsightedness. People with high degrees of myopia, nearsightedness, are at a higher risk of retinal detachment. Myopia causes the eye to elongate, making the retina more prone to tear or detach, especially if the vitreous separates from the retina. Previous eye surgery. Individuals who have undergone cataract surgery, glaucoma surgery, or other eye procedures may be at an increased risk of retinal detachment. The surgery or the tools used during the surgery can potentially cause trauma to the retina, increasing the risk of detachment. Family history. A family history of retinal detachment can also increase an individual's risk. Genetic factors may predispose certain individuals to have a higher likelihood of developing retinal detachment during their lifetime. Various eye conditions, such as lattice degeneration, thin areas in the retina, retinoschisis, splitting of the retina's layers, or uveitis, inflammation of the eye, can elevate the risk of retinal detachment. Treatment options. Surgery. Surgery is the primary treatment for retinal detachment. The goal of surgery is to reattach the retina to the back of the eye and prevent further detachment. The specific surgical approach depends on the type, severity, and location of the detachment. Common surgical procedures include scleral buckle. This procedure involves placing a silicone band or sponge on the outside of the eye, sclera, to counteract the force pulling the retina out of place. Vitrectomy. During a vitrectomy, the vitreous gel is removed, and a gas or silicone oil bubble is placed in the eye to push the retina back into position. Pneumatic retinopexy. This procedure involves injecting a gas bubble into the eye, which then pushes the detached retina back into place. Laser or freezing treatment is used to seal the tear. Laser or cryopexy. Laser surgery, photocoagulation, or cryopexy, freezing, can be used to seal tears or holes in the retina. These procedures create scars that secure the retina to the underlying tissue, preventing further detachment. Gas or silicone oil injection. A gas or silicone oil bubble can be injected into the vitreous cavity during surgery. The bubble helps push the detached retina back into place and allows the retina to reattach properly. Combination therapy. In some cases, a combination of treatments may be used to effectively reattach the retina. For example, a surgeon might use a scleral buckle along with a gas or silicone oil injection to achieve the best results. Postoperative care. After surgery, patients need to follow specific postoperative instructions, which may include positioning the head in a certain way to allow the gas bubble to exert pressure on the retina. Regular follow-up appointments are crucial to monitor progress and address any concerns. Conclusion: retinal detachment is a severe eye condition that can result in vision loss or blindness if left untreated. Understanding the types and causes of retinal detachment is essential for timely intervention and appropriate treatment. If you experience symptoms such as sudden flashes of light, floaters, or a curtain-like shadow over your vision, seek immediate medical attention. Early detection and prompt treatment significantly improve the chances of successful retinal reattachment and preservation of vision. Always consult with an ophthalmologist for personalized guidance and treatment options based on your specific situation.